I'm here in the pharmacogenetics lab of Dr. James Kennedy and Dr. Daniel Müller at the Center for Addiction and Mental Health. Dr. Müller, please tell us about your latest discovery.
Yes, weight gain is a serious side effect with antipsychotics, and unfortunately we see many patients who, because of their treatment, gain considerably amount of weight. And here the melanocortin 4 receptor plays a very important role. Therefore, we were very interested in looking into that gene. Among others, we were able to discover that variant which is close, relatively close to this melanocortin 4 receptor gene, but which has shown to dramatically modulate the effects on weight gain.
So why is this discovery important in the treatment of mental illness?
Because the idea behind is that people have maybe a very susceptible energy metabolism pathway, which then would be activated by antipsychotic drugs, or perhaps would lose the inhibition of, for example, appetite regulating signals. And in numbers, that means, for example, if the average patient gained 2 or 3 kilograms in a 12-week trial, with that variant, people were likely to gain 6, 7, or 8 kilograms within 12 weeks, and that's a tremendous amount of gained weight, which can lead to obesity, which then can lead to metabolic syndrome, and which then can lead to premature death. Therefore, any predictive tools that would be available to identify subjects at risk would be very helpful to help perhaps counteracting these effects, or also to develop new drugs.
How will this discovery change clinical care?
Once we have identified this variant or these variants in that gene region that are consistently associated with antipsychotic-induced weight gain, then we would be able to develop a test, a genetic test, for patients who are undergoing treatment to identify those at high risk and either look for alternative treatment or for a program which would include diet and exercise right from the beginning, or also perhaps to give counteractive side effect drugs.
Eventually, how will these findings be made accessible beyond CAMH?
Once a test is developed, it would certainly attract the attention also of pharmaceutical or biotech companies, who would then integrate this test into their panel that they already have for some other diseases or for some other pharmacogenetic phenotypes, and then it could be widely distributed across the world, perhaps.